And so I'm not going to shun it and look down on it because of that. I think they're doing the best that they can in terms of where it goes. It's just like how we perceive it. Does that make sense?
Okay. Okay. Well, aren't there and the deputy commissioner has joined us here in the studio. By the way, good morning, deputy commissioner. How are you?
Good morning. How you doing?
Hit that mic. Good morning.
Good morning.
How you doing?
Good. You want to introduce yourself?
Yes, Deputy Commissioner Renan Steele for Public Health at the Virgin Islands Department of Health.
Okay, good. Yeah. So no, I was just looking at it from the standpoint that where the hospital is located on St. Croix, with all that land over there, the government may not own it, but the government got some eminent domain and some other abilities to access, and we could keep everything in one area. From that standpoint,
I hear what you're saying. I just don't want the public to feel as though this is not where it should be.
Because for years, it was located inside the hospital.
Yeah, and right now we still have a morgue out inside the hospital.
Mm-hmm.
So I don't, and we're rebuilding the hospital, and the hospital is being rebuilt up as to what they had before the storm. So I'm sure that there's going to be a location for.
So then let me ask this question: Is this temporary?
I can't answer that question.
Oh, okay.
That's a question actually for the AG.
Okay.
So I won't be able to ask that question, but I
okay.
know for sure that whatever was in the hospital before the storm, FEMA has approved funding for after the storm.
Okay, no. Then we're good. We're good. No need to elaborate on that. Deputy Commissioner, how are you?
I'm good. How you doing, sir?
I'm good. Public health?
Yes.
And we also have someone on the line as well? Okay, yeah. Okay, we're streaming. So, put smiling on face so you can look good and all that stuff, right? Tell us about your coming to the Department of Health and all that stuff.
Yeah, well, we're coming in today to be able to share some information on behavioral health services within the territory, what we're currently doing at the Department of Health to address those needs. So we definitely want to share that. First, let's define what behavioral health and mental health is that we hear from.
Before that, I want you to talk to the public about you, because you've never been to analyze this. So talk about that, and you're in being a executive in the Department of Health.
Okay, sure. Mm-hmm. So I'm born and raised here in St. Croix. Mm-hmm. I went away. I'm a result after the Hurricane Hugo storms. I went away for a brief time, came back to the islands. I graduated here out of Central High School. Mm-hmm. Went away to the States to finish my education. So I've since...
What school you went to?
Went to Palm Beach Atlantic University.
Okay.
So I've been in Florida for about 19 years before moving back home in 2019. Mm-hmm. I spent the last 25 years of my career in the behavioral field. I'm a licensed psychotherapist since 2009, so I'm also a clinician providing services. Mm-hmm. I've been in the field of private practice in Florida for many years, also operating several residential programs, outpatient programs as a clinical director in the Palm Beach County area, working with the unhoused populations who have chronic disease, and of course spent most of that time specifically focused on those individuals who, because of the residential level, also have mental illness, which is the chronic side of the spectrum when it comes to behavioral health.
How long have you been with the Department of Health?
I've been with the Department of Health since 2019.
2019, okay, good. So behavioral health, by definition?
Yes. Behavioral health itself, the term is very broad, so it kind of covers everything under the umbrella from mental wellness to learning coping skills, to prevention services, to those who actually have diagnosed conditions, which is the mental illness side of things. And it also just covers interventions for substance use disorder as well. So it became the broader term that's more somewhat to make sure that we're not leaving out any specific group, because there's so many levels of specialized care under that umbrella. While mental health itself, as we talk about it, we always think of just the mental illness side of things, those who actually have diagnosed chronic conditions which require clinical treatment, often with medications, and then also those who may need to have residential or inpatient care because they're actually suffering from a diagnosed condition.
Tita, does the data, or is the data telling us that our mental health the population of those who are affected with mental health, is it greater now than it's ever been before? Commissioner?
All right, I just came back on. I got dropped. So I just came back after.
Okay, no, I was asking, is the data telling us that our population that's impacted by mental health, is it greater today than it's been in the past? You've lost her again? Okay, we're gonna work on that connection. Good morning, Christine Lett. How are you?
Morning. How are you?
I'm good. Glad to have you here.
Thank you.
You've been studying the data, Deputy Commissioner?
Yeah, I could discuss that.
You can speak to that.
From joining the team, and I kind of did some research a little before coming back. So I would say studying the data from about 2015 to current, we see, I don't want to say we see more mental illness in the community. What we're seeing is that as people this newer generation became more aware of addressing their mental wellness, and more individuals have been seeking services so that they cannot reach to the point where they decompensate with the need in more inpatient care. So we definitely saw increase in numbers of those accessing our outpatient clinic services, which is the the offices where we have psychiatric care, case management, counseling. We have a strong outreach program, so we've been seeing more individuals taking advantage of those services available to them. There are those individuals, of course, that we all see out there that's on the, where we assume immediately, because if they're unhoused or if they're in a community, appearing to not be what we think society norms want to say, put labels on that. But not all those individuals that you see out there they may not even have a diagnosed condition as far as mental illness goes, but some also is specific to substance use. And then we also see those who just choose to be homeless, and which within itself is not a crime. So, but overall, I would say we see more individuals receiving services has grown exponentially to say, which is a good thing for them accessing the services so that they can get the proper care they need along the way.
Commissioner, you want to?
No, I'm here.
You're
I'm
good.
back on.
You want to piggyback on what your deputies just spoke about?
I didn't hear everything that he spoke about.
Well, he was saying that the population is seeking help, or what's the terminology we're using?
Seeking more services.
Seeking services, so that would actually be a preemptive type approach, right?
Correct.
To not get to the point where they're fully impacted with mental
illness.
Illness, correct. Talk a little bit about that.
Yeah, well, I think that one of the things that we're doing that is important is that we are not waiting for the community to come to us, but we are actually going to them. And we've actually started a program. It's a weekly wellness program that they go out every week. It started several weeks ago. Going into schools have been going on for several years, but more going into the community members, into the housing facilities, and meeting with them and seeing what is happening. But we're not focusing just on behavioral health or mental illness. We're focused on some of the things that can impact mental wellness, and that is chronic disease, that is acute care, acute illnesses, those kind of things, identifying what's happening within the home, the social determinants of health, what's causing individuals to be ill physiologically as well as psychologically. So those are some of the things that we're doing right now. So we have a wonderful team at the Department of Health, Behavioral Health Division, that's going into. We're working with HIDA, the High Intensity Drug Enforcement Unit, to combat misuse or substance use within the school population, within the home population, so that we can do it. Because that we have actually having a rise in different use of drugs within the territory. And that in itself is a part of behavioral health and the work that we do. So I think we're doing quite a bit.
Now, let me see. Late 2016, the legislature, and you weren't in the position that you're in now back then, but the legislature, along with the Superior Court, we had recognized that we had a problem here in the territory, and we're looking for locations to address our mentally impacted population. Do we have any physical structures right now, or are we still where we were some 10 years ago?
The only physical structure we have within the territory is Elder Shelter Brand, which is more long-term care. We utilize it as for a transitional site at times. The judges are aware that we have elder shelter brand, and sometimes they're requesting or mandate that we place individuals within elder shelter brand. And we educate because we have to be very careful because of the population that's there now are not as acute, and so we try not to have acute individuals placed within that location. Unfortunately, that's all we have right now. So we try to focus on our wraparound services, which is to decrease the need for hospitalization. That really is the goal.
No, hold on a second. I don't want to cut you off before you get into full detail there, because we're going to go to a break. We got the Department of Health here on the line and in the studio. We got Commissioner Justa Encarnacion, Deputy Commissioner Renan, that's it pronounced?
Yeah.
Renan Steele, and also the voice of the Department of Health, Christine Lett, here in the studio as well. We'll take a break and be back right after this. And we're back here on Analyze This. We got the Department of Health here in the studio and on the line as well. Commissioner Encarnacion and Deputy Commissioner Steele, along with Ms. Christine Lett, Public Information. So, Commissioner, you were talking about the long-term care that's available in the territory right now, even though it's limited.
Yeah, we are limited, so we try to focus on the service and prevention of admission to facilities. If individuals need to be sent to a facility or taken to a facility, if involuntary committed or as a result of a crime committed and they need forensic assistance, then we transfer them outside of the territory. We acknowledge is it the best we're working with a company in Puerto Rico, which is closer, so that we can try and transfer the ones that we have in the mainland closer to us, which would be in Puerto Rico. We've actually met with them, what campuses. But we need to ensure that the public knows that a facility is important in reference to some of the services, chronic and long-term care facilities and acute facilities as well. But the wraparound service is critical, and we are continuing to work as best as we can to make sure that we combine these goals. I know that Renan would have some input in that as well to what we're doing and what we can do differently. And just to let you know that I think we're open for conversations about that. We're open for discussions as well to listen to the public because that's how we grow. Dan, you want to add that?
Deputy Commissioner?
Yeah. I think she was referring to the fact that as we determining right now that we don't have the facility in territory, that she was mentioning that we're collaborating and discussing potentially working with an expansion of another program in Puerto Rico who've shown some interest so that they can at least be closer to home at this time, because bringing the facility here is not just the building. We need the services and the specialized professionals to be able to operate such services. I think when we think of individuals being hospitalized or going to off-island care long term, but there's many levels to those services, so many levels of diagnosis criteria. So, for example, we think of the forensic population who has been involved with the court system, who may have committed a crime or infraction, that those go to forensic treatment programs, a very specific type of care, as well as we have a population of those who are intellectually disabled. So these are the individuals now who fall under the spectrum of developmental disorders, and they cannot be placed in the same type of facility, and it's a whole different treatment approach, as well as those who just need stabilization because they have a diagnosis or a condition that may have kind of gone off tracks. We call it relapse back in services, and then once they're stabilized, they're also able to come back to community and home. And that's the national trend everywhere. And treatment in community is the trend, and they try to minimize or reduce the commitment of individuals because we're supposed to treat them in the least restrictive environment at all times and based on their care that they specifically need.
Commish, good morning once again.
Yes, sir. Mm-hmm.
So, tell me about this back and forth you got with Senator Vielle. I know I go way back. All of we raise up. All of we raise up together here.
In a good way. We go way back in a good way.
Mm-hmm.
Senator Vielle, as well as Senator Francis and others, you have been such a support for behavioral health as well as health in general. So I wouldn't call it a back and forth because and like I just said, is that sometimes we need to listen to what other people are saying and sometimes we clarify. And I think that's essential, is clarifying what's being said and try and put it into perspective. But Senator has always been a supporter to behavioral health. I think you know that.
Mm-hmm.
And when you look at behavioral health and when people that you know are affected with mental illness, it puts you in a completely different level of caring, and urgency takes place as well. What are we doing? What can we do differently? And so we're here to show you what we're doing or to tell you what we're doing. And sometimes we get information from others. What can we do differently? Because we're not all perfect. There's only one, and that is God. And so we try to listen to what's happening within the territory and provide the services that's needed. But I want to make sure that the community knows that, despite of what anyone says, that our team at Behavioral Health are dedicated, and they are working diligently to make sure that the services are provided. One of the things the legislature did for us not too long ago is that we did have an act that was passed having to do with the crisis intervention process and the 988, connected with the 988 process, right? But the funding isn't there. So saying that the bill has passed with an unfunded bill means that we have to seek the funding and the care linked to the funding, because as DCC was saying, mental illness and the care related to mental illness and mental health is very expensive. Coming from a hospital system, looking at what the cost of care is on a psychiatric unit, it could be millions of dollars annually. That's something that we can't say we're going to do this year, but then we don't keep it up next year or the year after. It has to be something that we put in place that's consistently there in the budget on an annual basis. So that means adding millions of dollars. And I know that we do have millions of dollars coming out from the off-island care. There has to be a transition to that. We cannot just shut down off-island care outside of the territory and build as well as add to what's happening in the territory. So we have to have that transitional period. We're going to have funding for off-island and funding to build and actually clinically support what's happening right now. If that makes sense to you.
Well, as a former legislator, and I was actually there when some of these legislations were actually enacted. And he pointed out, beginning back in the 32nd legislature, Act 8152, which appropriated $2 million for mobile wellness vans for St. Croix, St. Thomas, and St. John. Did we get those?
Okay. Not only do we get them, we actually have them out on a weekly basis. So I know that one of the things is that we do not have the DC to let you know, but there's a community outreach program that is active. But even prior to that activation of that program, the vans are out in schools and on a weekly basis. That's been happening since we got that. There have been times when some of the vans have been down, but as a count, as soon as the vans get back up, we're out there. I can tell you how much the staff is actually doing and how active they are.
Okay. And then, what about the land that we had worked on in Anna's Hope? Could you situate your phone a little differently because you're going in and out a little bit? That's a landline or a cell?
That's a cell.
It's a cell. Okay.
Actually, out of territory.
Okay. You better. That's better. That's good.
Better?
Yeah. Go ahead.
Okay. Good.
Yeah.
All right. So thanks for asking about the land. We have a little over 9 acres land outside the legislature, so thank you for that. Thankful for that. So one of the things that we did is we utilized some of the funding. We attempted to utilize some of the funding to, one, we always try to clear out the land, but do an assessment of what we can do on that land. And a lot of people don't realize this, but involved with like what we're doing with the Donna Christian, the new public health building, as well as what the hospitals are doing. Construction cost is so high at this point in time. They were projecting over $30 million to completely put what we need on that land. Not to say that we wanted everything right away.
We're talking about the Charles Howard or the Anna's Hope?
The Anna's Hope.
$9 million or so?
$30 million.
Only $30 million.
Right. So what we were looking at is for them to develop a structure that we can actually piecemeal. So what do we need first? And that would be wraparound services. It would be transitional homes, and then we could build. So just because we said 30 million, we need 30 million right away, but we need the fund to build. We need the funding to support the clinical care within the building on a consistent basis. So those kind of things that funding we don't have at this moment, but doesn't mean that we don't need it in the future. Like I said, we have to balance it. Do we have the funding to build? Do we have the funding to supply the staffing and the equipment? At the same time, do we have the funding to provide services off island? Because we have to balance both. We can't just shut down off island services because we're building out within a territory. So we have to have a true plan in place financially as well to be able to make this work.
Deputy Commissioner, what's the biggest need right now? What's the priority need right now for behavioral services and mental health in the territory?
The priority need right now is, as Commissioner mentioned, is multifold. Of course, we do wish we could have a location locally that could be funded adequately to provide these services. However, we also need the workforce is always a challenge. We have a dedicated team right now, and I thank them for what they do every day, but we're not seeing a lot of individuals going into the field of working in behavioral health, so we don't have a large pool of pull from resources of individuals who can think. So there is some vacancies that could be filled within behavioral team. And as we also mentioned, for a real full-time crisis intervention team, that also requires additional funding because that's a 365-day, 24/7 operation. We do it currently now with the same staff that's providing the services in outpatient care. So now we're pulling them from other services for individuals to bring them out to the community so that we can respond to those incidents, but we could have an increase in staffing. And I want to add to that, the 30 million Commissioner's Talmud was just the first phase for one level of care for that residential facility. When we saw the figures, the full complex, comprehensive location, it was a full treatment center, including detox services, forensic units, inpatient, short-term residential, and transitional. We were talking 232 million was the quote that was provided. If we have a full comprehensive behavioral health facility that would be accredited meeting all standards of care so that it does not become a sustained expense, because if it's not accredited and don't meet CMS standards, we're not going to be able to bill and have insurance reimbursements. We're not going to be able to get any other funding for that. It'll become a permanent expense on the government. So we not just could put up a building for a building's sake. You have to meet all the standards of care for residential treatment and all those other levels we discussed.
But we need to be realistic, though. We can't afford a $230 million
Correct. And that's why there's other discussions going on now. We have our second set of ESF that's being discussed. That's been in an appeal process right now with the FEMA administration, as it was damaged in the storms in 2017. That's in the St. Thomas district, of course. So that's 32 beds that we would like to get back on track to be able to at least reduce some of the off-island and care expenses. Commissioner mentioned we have a facility in Puerto Rico that we're discussing with, because the rates that's being proposed is cheaper than what we're currently paying for some of those forensic populations. So we're finding ways to be able to cut the costs and still maintain the services while we implement something here on a smaller scale to have a beginning, at least, so we can start having the services more localized, which again also reduces costs significantly and for improve better treatment, because now families can stay engaged with their loved ones.
So, Commissioner, the question then is, as you know, me being an outsider now, I haven't been inside. Why not articulate to the public that the problem that we're dealing with, or the challenges that we're dealing with, is bigger than the executive and the legislative branch, and that both branches are working with available resources? Because the impression that we're getting when we read the stories is that it's a back and forth with executive and legislative branch, when in fact that's not the case.
No, it's not the case at all. And it's actually all three branches, because the courts and
Correct.
the Department of Justice actually is very much involved in this. And so one of the biggest proponents for the bill was part of the justice system. And so if we work together to understand the financial responsibilities for it, as DCC is speaking about, the geographic need for it, and really and truly the impact for families outside of those that are affected with with mental illness. All of those components need to be understood. I think that this conversation is deeper than we've gone in the past in reference to what the needs are from a structure standpoint. So I think that you're right. I think we need to continue these conversations so that the community can know. And maybe someone out there might say, you know something, we have funding that we can actually provide to you as well. So how can we work together? Because it's the best is actually is private, public, and nonprofit. If we have those three entities working together, then we could get so much more done, rather than saying that the public is the only person that needs to put in a lot of funding to assist with behavioral health or long-term care services. We have people, philanthropics, throughout the territory, so let's figure out exactly what we need to do together to get it done.
Ms. Lett, you're the good morning. You're the voice for the Department of Health, and just because Tita is your boss,
I was about to say
that don't mean that from a perception standpoint, an optics standpoint, that you can give some advice, right? And what we're dealing with now, you know, the issue really should be how do we get to where we want to get to, as opposed to finger pointing. Now, I know the arena, and I haven't been in the legislative arena, and Senator Villa is absolutely well within his right to defend himself, in particular when he's pointed out the legislative actions that have taken place from a funding standpoint. There are those who believe that the legislature, after they appropriate money, they're supposed to actually go out and do the job. And that's not your fault. Senators have actually misled the public over the years into thinking that when they appropriate money to pave the road, that they're supposed to go out now and actually pave the road. And, you know, we paid a penalty for that over the last 40, 50 years. But the real issue now is what we're articulating here today, which is we have money that has been appropriated, but maybe the money isn't getting down to the levels that it should. That's number one. Number two, while we're talking, the cost for construction, for facilities and all that stuff continues to to go up. We got supply chain issues over the last 4 years. Things have just exponentially increased, what have you. So how do you, in your role as a voice of the department, get the public more informed to where they have a better feel for what we're dealing with?
Well, I think exactly what we're doing today, and we realize there's it's sort of a gap in the communication about what we do and what we can provide and what we're trying to do for the future, and that's what Commissioner is talking about today. So getting in spaces like here, talking about it, I think we do need to do more in the community so they can better understand how we manage individuals with mental illness, behavioral health issues, and then we also have to explain, because for community, I think we're going to commercial.
Well, we could go.
Okay. Yes.
Let me go to the break and pick it back up with you.
Okay.
When we come back, and then when we come back, I'll also ask, what's the next step? So we'll take a break.
Okay.
Be back right after this. And we're back here and analyze this, talking with the Department of Health and the Public Information. What's it, Director? What's the title?
Communications Director. Communications Director.
Communications Director Christine Lett
Yes.
was in the middle of articulating some of the things that they want to do to get the public more informed and actually, represent the agency. So go right ahead again.
Right.
Yeah.
So, I would say that one of the things that we're trying to do more is have conversations like the ones we're having today with community leaders such as yourself, but also going into the community. And, we realize as well, despite all the hard work we're doing, there's still some misconceptions that we need to clear up. Of course, the governor had the conversation about the funding for the facility, but there's also the conversation about the homeless and then being mentally ill and what we're doing. So we want to educate the public more about where the Department of Health comes in as far as how we care for our people that have issues and clear up the the misconception that we're sitting idly by while there's folks out there that are mentally ill and just roaming the streets. That's one thing we do want to clear up, and we're working hard at that.
Okay, good. Question from the audience, Commissioner. When is the flu shot going to be available, and where are we 6 years removed from the pandemic and the vaccines and booster shots and stuff like that?
The flu shots are actually available.
The flu shots are...
For those, it's available, but right now it's available for those without insurance. And from a federal standpoint, that's who we can provide the flu shot for. We're working with companies to get back into... the company that we use for our vaccine closed down, so that's no control of ours. So we're working with companies so that we can actually get relationships with them so we can start pulling vaccines back to the territory. And we've been successful with, of course, the pediatric vaccines. We're working on getting the flu shot here as well as the COVID vaccines. But we do have, like I said, we have those available for those without insurance. And that's available at our community health centers in St. Croix, St. Thomas, and on St. John as well. In reference to where we have gone since the pandemic, COVID, we can't even say COVID is gone because we still count our numbers for COVID. And sometimes when, this year has been a very strong acute flu season. So the flu this year seems to be even higher in terms of the intensity and the acuity of the flu. Individuals are experiencing gastrointestinal symptoms as well as respiratory symptoms this flu season, sometimes combined. So the hospital's emergency room has been overflowing with individuals with flu symptoms. And so we always ask, go to your private entity, not just the emergency room, because it takes away from the more highly acute phases that need to be in the emergency room. But we're still working. We're still working with COVID. We work with our HSS. So we actually have HSS on the ground this week, Human Health and Human Services, from a emergency action standpoint, working with our preparedness team. So we continue to do that. Dr. Hunt, Caesar, as well as our preparedness team and HSS, just maybe about 2 months ago, pulled a team down speaking about highly infectious diseases, looking for the future just in case, what do we do? So there is a apparatus that the St. Croix Hospital was given, JFL was given, and we're actually going to have 2 of those that if we have highly contagious diseases, we actually can isolate immediately in the emergency room, around the emergency room at both St. Croix and St. Thomas. The RLS have actually gotten a grant with our help to teach individuals about illnesses such as those and bump us up to another level in terms of infectious disease care, working closely with the only infectious disease physician we have in the territory, Dr. Tyhan Caesar. So I think we've done a lot. We're keeping up to the trend that's happening nationally and internationally and trying to make sure that we're ready if something actually occurs again.
Deputy Commissioner, good morning once again.
Yes.
If resources were made available, what would be the areas that you would apply those resources to?
I would definitely say we do need a treatment facility so we can have all levels of care covered. But we also need an expansion of the workforce. And the major gap that individuals now have is identify is even after treatment, post-treatment, now where do these individuals go? We have a lot of situations where individuals have received the treatment they needed, they're ready for discharge, yet there's no place to bring them back home to. Mm-hmm. Families decide they can no longer reside with them, or families have passed on, etc. We have no housing availability in the territory that's affordable for individuals in these situations. The few facilities that accept those population, we have placed individuals there. Those are capped out. They're also lacking resources to expand. So there's also, from the time someone is stabilized, hospitalized, and they're not able to go, let's say they don't need full residential, they need short-term residential. That's why they go out of the territory. So we have a gap of short-term residential. We have the gap on the other side of the transitional care when they come back, transitional living facilities, and then affordable housing on the back end so that you can sustain them in the community.
Correct.
While they're stable and doing well, and then wrap the services around them, making sure case management have is there on a weekly basis. Therapists is available to them. The doctors do rotations, checking on them so that you're maintaining them on their health, just like you maintain any other severe health condition. It's just like a diabetic patient. After they come in for treatment, you still want to make sure they constantly have the services to sustain them and keep them as well as you possibly can. So we have a few gaps that even if putting in the treatment facility, which will only cover the inpatient care, housing and stabilized housing and transitional living will still remain an issue after treatment, because we can't keep people indefinitely committed. That's not how it works.
Tita, I'm gonna be honest with you.
Yeah.
And you know, speaking to you on a Neville to Tita basis here. I am seeing more individuals walking around with their clothes that ever before, and it's painful, you know, and not only that, it's hazardous because they're on the side of the road sometimes, and you know, if lighting isn't suitable and you see them at the last minute, that could lead to a tragic situation. How do we go about? Have you spoken with the governor? Have you spoken with who else would you speak with? Because compared to back in the day, that was not the case. I'm just being very candid. You know, we didn't have that. It wasn't to the extent that it is prevalent now. Now they're human. They're human beings. We need to show them love because they're family, they're friends, what have you. But it's a hazard.
Yeah, I agree with you. We're seeing a lot more, and sometimes it's because of the coldness that's occurring throughout the mainland, and families are bringing their own families here. So we're seeing not only locals, we're seeing individuals who are not from our territory that comes and now their home is on the street. So we're seeing that as well. And we, as part of what we do, is go out to make assessments. Is there a mental illness involved in this as well? Is there anything wraparound services that they need, and how we pull them into our services that we have available? In terms of who we can speak to outside, it's also the Department of Human Services, and DC Steele and the team meet with them in an interagency on an ongoing basis. And so we do that. We also have our interdepartmental meeting that met this week that focuses on behavioral health, and we have all components, nonprofit, VIPD, hospitals are involved, human services, a lot of different entities are involved in that, disabilities involved in that as well. So everyone that you spoke about in terms of, or you thought about in terms of who should be at the table, we have at the table at that point in time. In terms of housing, of course, that's more Housing Authority as well as Human Services, and so we partner with Human Services and Commissioner Albert Bryan Jr. on a basis when the need is there, and when we see when it is brought to us, as well as when we go out and we investigate and we see. So I think we go back to, we can't do it. If one entity can't do it, it has to be a collaborative effort in getting this thing done. So those are the ones who should be at the table, and we do have Human Services actually is part of that homeless or seeking housing, and so we are part of that community, and Renan Steele actually is our representative to that.
Final question, for those who are listening and viewing, if they want to be more educated about information where public health is concerned, where can they go to? Who can they call?
Well, you have the voice of public health right there with you, Christine Lett, and she keeps up our website. Is kept up really good, extremely well. Social media, she changes social media every single day. There's something on social media having to do with what's going on in public health in the Virgin Islands, as well as external to us as well. So that's one of the areas that you can do. Renan, if you have the numbers for behavioral health, if you can provide those, that would be excellent. And Christine, if you can add anything else in terms of communication and how the people in the territory can learn more about what we do, please do so.
Yes, and if you need to access services in the St. Croix district, the number is 340-712-0096. St. Thomas district is 340-774-7700, and St. John is 340-776-6400. Those are the numbers to our outpatient clinics so that you can access services, and then you will follow up from there.
Ms. Lett?
Well, I think he has the numbers on our website is www.doh.vi.gov. Can I add one more note?
Go ahead.
I just wanted to make sure, and I know Commissioner knows this, and if DC still can speak to it, how we approach people who are homeless and their rights, if you could just put that on the record.
Yeah, so
of course.
yes, so what I'm referring to, as you mentioned, those individuals, as we said earlier, we do go out on complete assessments. However, if you assess an individual in the community on the street and they do not pose a risk of harm to self, danger to another person at that time, or in the process of an actual act of crime or violence, we are not legally able to just commit that person or pick that person up and take them into the hospitals. They still have the human rights, and we cannot violate those rights. But we continue to try to engage them. We still offer them services. We check back with them in a few days, sometime the week later, and see if they're willing to voluntarily get some services if they need be. And we often find when we do those assessments to a lot of the unhoused population, many of them don't have a mental health diagnosis. They're sometimes choosing, telling us, well, we've heard I can't afford the rents in this territory, but I'm here and I can't do it, and I refuse to spend that kind of money. We've had individuals who say, like Commissioner mentioned, they're not from here. I come down, it's warmer, so I can live on the beach. We've heard those terms.
But how they get here?
Their families are providing that transport. They're giving them one-way plane tickets, and they're coming down. And we've heard it directly from those consumers, and we come across in the community. And of course, we do have some local population who, again, even though they may have a diagnosis now,
so you come on a plane, your family pay for a ticket, and when you land at the airport,
they just
you're totally on your own. You're totally on your own.
Yes, we've come across many.
I have to tell you, and if I may, Commissioner George and her team actually are monitoring that, and they have on many occasions actually sent those individuals back. So it's something that's being monitored and worked on by Human Services as well.
Okay. No, both Governor Bryan and, by the way, he got a new nickname. When you see Tita, Cali Engine, right? Cali Engine. He wanted to know what Engine mean. I told him, you're the ninth governor. And we were growing up Engine number 9. You know what I mean? So we had a good fun. We had a good joke with that one. So teasy about that one. But both him and his predecessor declared state of emergency for public health. So what are we going to do? I mean, we got to figure out something. I mean, if it's a resource issue, then you got to wait till available resources. But if both governors have declared that mental health is an emergency here in the territory, and we're 8 years removed from the previous governor, how do we go about fixing this?
And continue to speaking about it as one of the things that we have to do, acknowledge where we have faults, where we have where we're missing, what we need to do, where we have gaps, and start to build upon it. I think that we are very vocal from a public health standpoint of what our needs are, and we ask for the continued support from all branches to assist us in getting there. And I one of the things you spoke about earlier, and you know, maybe you can help us with this as well, is really figuring out how we can take this from our level to a philanthropic level and see if we can get the funding outside to really secure what we need to do to get the infrastructure going within the territory. I think that we need to look at it from a different perspective. We've been leaning on the government, and right now, you know, the government funding isn't what we want it to be for circumstances sometimes that we don't have control over. So what do we do differently? I think this is the question we have to ask ourselves. What do we do differently? Who do we pull in? And what type of control do we have at this time?
Mm-hmm. Okay, check this out. I don't want to rush you off the phone, right? And we're going to our break. So I got two questions. I'll ask them now, and then you could think about it.
Okay.
The chikungunya, is the vaccine available for all? Number one. And then number two, back to the flu shot. For those who have insurance, where are we guiding them to? Because you said the priority right now are for those who don't have insurance.
Right.
If I heard you correctly, right? So think about that when we come back. You can answer those questions, and I'll excuse you and your big shots that are here in the studio. We'll be back right after this.
Okay. Thanks.
The views and opinions expressed on Analyze This are entirely those of the on-air participants and do not reflect those of the station's board, management, staff, or underwriters. The views and opinions expressed on Analyze This are entirely those of the on-air participants and do not reflect those of the station's board, management, staff, or underwriters.
And we're back here to analyze this, wrapping up our conversation with the leadership at the Department of Health. We got Commissioner Justa Encarnacion. We got Deputy Commissioner Renan. I want to pronounce it correctly.
Renan.
Renan Steele. And we got Communications Director Christine Leck. Good morning to all of you.
Good morning.
Yeah, so Commish, the chikungunya, flu shots for those who have insurance.
I have a surprise for you. Dr. Hunt?
Good morning.
I just sent a text message asking for you that in local language. What going on? What going on? What going on? TCHC. Everything good or what?
Everything is well. Thank you so much.
Happy January, card. The New Year done. And
Yes.
February gonna be on Sunday. So good to
Well,
hear. Yeah.
I'll just take this shout out to say happy birthday to my daughter tomorrow.
Oh, that's what I'm talking about. Happy birthday.
Yeah.
Double digits.
Yeah.
Yeah.
That's what I'm talking about. That's what I'm talking
Happy birthday, Sage.
about. Yeah. Yeah, so the vaccine for chikungunya, and what are we telling those who have insurance with respect to the flu shot?
Sure. So there is a vaccine for chikungunya that is available in limited limited situations. We will have access to actually ordering the chikungunya vaccine if an outbreak is declared. So in the event that there is a declaration, then we would have access to actually order so that it can be widely distributed to the public. So it's not readily available right now.
Okay. Now,
For
no, go
flu
ahead.
shots,
Go ahead with the flu shots for those who are insured.
for, yes, for flu shots, with the stock that we have, though that is for we prioritize, and it's actually specifically available for those who are uninsured, and for those who do have insurance and have access. We have been referring those to private providers who do provide the flu shot and have access to order it, and pharmacies as well. Private providers and pharmacies that actually distribute the flu shot.
Okay, good. Now, we got the Department of Agriculture, right? They're on the line already, right? Right. So I want to ask this question, right? When the chikungunya, I believe, when it came here, we heard a lot of our local people referring to bush, right? Noni, ni, maranga, all them kind of thing, right? Now I know I use medicine pros and all that stuff, went to school, get the documentation and all that good stuff. But what about our local remedies? Is that something that we could be novel with in terms of us knowing that bush have worked to help remedy a lot of sicknesses here in the territory, and maybe we could be creative and do something here that we could be a leader, a trendsetter. Is that possible?
I think that one of the things that we have to remember is that medications, traditional, is actually stems a lot from the bush, the leaves that have. So I don't think that we should never ever discount that. I think that we also have to remember is that right now we do have individuals on medications, prescribed medications, and we have to make sure that they are looking at what they're taking from a bush perspective, because that also has an impact of what you're taking from a medical perspective as well. It's a combination of both. But I would never say put the bush back, because it has really given us so much in the past, and it continues to do it on an ongoing basis. It's healthy. There's no reason to just put it back. But from a medical standpoint, I will have Dr. Hunt speak to that a little bit more.
Sure. Just like what the commissioner stated, one doesn't have to be independent of another. And most of the medicines that has been developed, like the commissioner said, was developed with research from natural products. The only thing that's different is just that it's processed, and it's made in a way where we understand exactly how it's released and how it works in the body. So the flip side to that would be taking a natural substance and you sort of taking it, whether it's a tea, whether it's another form. There's no way to know exactly how much you have to take or what the effect would be like. So those are the differences. I'm not a naturalist, so I'm not able to speak as an expert on exactly how natural medicine would work, but it's not something that we would discount. The pain and the pathophysiology behind what happens when you get chikungunya, it's an arthritis, right? So it's dealing with inflammation, chronic inflammation that can last for a long time. So if you are able to take natural substances that helps with that inflammation, then sure, by all means, if it helps, then we of course would recommend it and urge you to also take it, especially if it would limit the amount of prescription medications that you would have to take.
Neville, if I can, I'm going to go back to using the term bush and focusing on marijuana and the use of marijuana today and what that actually means, and going back to behavioral health and substance use.
Tita,
I think
what you know about ganja?
A lot of us.
What you know about ganja?
Well, let me tell you what I do know right now, okay? Is that we have a lot of young people, especially in the 20s, that are using marijuana, that have synthetics in them, that's no longer what marijuana like we used to know it. And because of that, they're developing psychosis or psychotic symptoms related to that, going right back to mental illness and having to be treated. And as a result of that, what we're looking at right now, we actually just did a talk with HIDA last week last week when I was in St. Thomas, and Christine was there as well, what we're looking at within a territory, how many illnesses that we're seeing from a psychotic standpoint because of the use of non-traditional marijuana. How about that?
No, that's exactly it. Remember when we were growing up, weed, tampi, ganja, you know what I mean? The real thing, kaya, you know what I'm saying? And you're absolutely correct. They're following people. Remember when we were growing up and our parents used to tell us, stop following people, don't be following people. And that is way too prevalent nowadays. And you're right.
And we're seeing, and a lot of people what you're seeing on the street are haven't been affected of that linked with the synthetics that are in there.
Yeah,
and as well as the opioids that's being used and how it's being
created,
used.
they're experimenting, and they're putting themselves at risk, right? And let's face it, that crack, would you believe, 40 years old, pretty much mid-80s, right? And we saw what that did to communities, devastated communities all over the place.
So we have to be very, very careful, and Renan can speak to that because he sees it on an ongoing basis. We have to speak to it because it's happening, and we have to try to prevent it. And friends that are out there encouraging other friends to do the same thing, that's causing increased illness within our territory and a risk to our youth.
Quickly, Mr. Deputy Commissioner Steele.
Yes, and even a little further than even just the synthetics and opioids that we've seen and the synthetics marijuana, we're also seeing the THC gummies that's been causing a lot of havoc with the school-age children
and the brownies, right?
And the brownies. And it goes back to what Dr. Tai Hunt just briefly mentioned. They have no knowledge of how much the dosage is in those things and what's the THC level of those products. And there's certain deltas of those THC. As you recently know, legislation also was trying to make sure that we ban DC-8s and deltas 9 and stuff because those things are completely synthesized into
and marijuana is still a Schedule 1?
As of now.
As of now, it's a Schedule 1 job. Of course, there's debate. And
there's a debate, current administration will make changes, etc. Yes.
Well, let me just read quickly a couple comments here before I excuse Ayo. One of my listeners said, always thought a mobile shower with basic necessities would be a neat thing to do, to stage at various points throughout the city, in this case the islands, on various set dates, so that those living on the streets would have an opportunity to clean up and hopefully make contact with the services. So, I know that's, it's easy to talk that talk, and I support it, right? But to actually implement it and all that stuff, and for it to not be abused, what I'm saying, that's the biggest concern.
One of the senators actually brought that up to me, Senator Lewis did, and I don't know if he's going to put a bill in place for that. But that's one of the recommendations that came, and hopefully that comes through as well.
Yeah, and real briefly on that, I sit also with the Territorial Homeless Coalition group. There actually is one mobile shower system set up in St. Thomas that's not able to mobilize because now they needed a truck head to move it. There's been discussions in that group, and they're trying to also get one for St. Croix. So that thought is already in effect and moving forward between all the non-for-profit homeless organizations.
Another listener talked about the Mitchell Motel in St. Thomas. That used to be. It's abandoned, right, in the lower John Dunkel area, and now owned by the government for the past few years, and maybe the government could look at, refurbishing.
We actually did. We PMP. I can't remember which senator took us out there. I think it was Gregory Frett at that time. We actually went out there even prior to that. We did an assessment. Fred Gregory. My apologies, my sir. But we actually looked at that, and the engineer determined that it was no longer a safe space or a safe place to actually renovate. So that's something that I think is best being torn down at this point in time. So that was one of the conversations we've been having. Thanks to all of you. Appreciate you making some time to join us this morning. Enjoy the weekend. The fair coming up in 2 weeks. I'm going to be at the fair, right? You're going to have a booth at the fair?
We'll have the vans and full booths.
Always, as always.
Okay, good thing.
Thank you.
Okay, glad to have you here. And Ms. Lett, good to see you as well. And
Same.
Renan Steele. Nice to have you here on the show. Okay, thank you. Medical Director and Commissioner. Appreciate all you joining us this morning.
Thank you very much.
And tell Esther, say hail up.
Yes.
When you see Esther, tell her say hail up. Okay?
Okay.
Good. Thank you very much to the Department of Health for joining us
Thank you.
this morning. Let's get